evening, Vancouver. My name is Valerie, and I am delighted to be your very first Health Talk speaker of 2017. I have a lot of hopes for healthcare, and my very first one is that you will go home inspired by something you learned from someone else at this conference, because looking at yourself all the time isn't a great way to keep going on learning. So I thought I would share some photos from my life in northern BC, and then try to make a connection between healthcare and two of my other passions, which are singing and farming. I think as we go along, you'll see the similarities. For about 12 years, I was the director of a small a cappella ensemble called the Apple Corps, which included my brother, my husband, and my sister-in-law. And you can imagine that there were some times when I thought we should do something big and black, and they thought we should do something small and white. We had a lot of listening to do to each other, and when we didn't, it was like we were swimming in opposite directions aimlessly. We didn't know where we were going as a group. In choirs, that leads to a lot of awful disharmonies. In healthcare, that can lead to a loss of relationship with your client. And that can make things really difficult, like lifting a piano. I would like to tell you about my most difficult client of my career so far. She was extremely intelligent, devastatingly disabled by a stroke. But she would smile sweetly and agree with everything I suggested as her occupational therapist, and then write me a scathing email the next day, taking apart everything I thought we'd accomplished. It was a bit like holding hands with your favorite bull. I loved her dearly, but I was never very secure in my relationship with her, nor did I feel very secure in my skills as an occupational therapist. She died recently with a lot of unfinished business, and I don't know what we could have accomplished. But what I think I did do right is I sat back and I listened to her. And it takes a lot of time to listen to your clients and really find out what are their goals, what do they want, but that's what we're there for. And if we don't listen, where you're going to end up is somewhere other than Earth, like Mars, going down a road with no exit from a whole lot of potentially ineffective healthcare options. And that is not where we want to be. We want to help our clients navigate that system. But we know that no two clients are the same, just like no two cabbages are the same. And what works well for one might be the polar opposite of what works for someone else. So again, we are going to have to listen to find out what is it that our clients want. Some clients have very simple goals. This is Susanna. She is one of my favorite sows of all time. And her goals, simple. And not only that, I was able to meet them with very simple therapy, providing the basics. That's all she needed. Not all clients are as simple as Susanna. This is Putty, and I'm sure he has a hidden agenda somewhere. I don't know what he really does, nothing really. He just shows up a lot and expects to be cosseted, which we do. But I don't really know who's in charge of the relationship with Putty. This is Turnip. He's another example of a guy that just needs a lot of listening to, a lot of stroking, and a lot of just chilling out like that. So listening to our different clients is what we do in healthcare. And speaking of listening and sometimes directing, I have two teenagers. This is Jeremy. He's almost 13. And Jeremy will never be a farmer. And he probably won't work in healthcare either. But he is a musician. And listening to him sing and play his instruments has been, and I hope will continue to be, one of the most incredible pleasures of my life. This is Rachel. She's almost 15, and she is also a musician. She will definitely be a farmer someday, and she wants to be a vascular surgeon. So she completes my analogy all by herself. I think I have a lot of listening ahead of me, just in my family, never mind my clients. When we hold the trust of what our clients come to us with, their goals, their hopes, their desires, we hold something so incredibly precious and also fragile. If we don't listen we might miss what our clients want. And your pile of eggs might be piled up now, but it's only a split second before it might come tumbling down. We're not talking about us and them. We're talking about us and us. This healthcare system is for us too. And if we don't build our partnerships with our clients, we might miss the whole boat on that. Like Rachel on the beautiful Phoenix. They're a unique partnership. He doesn't have to be there. He doesn't have a saddle on. He doesn't have a bridle on. He's there because he wants to be there, and he is creating with Rachel a beautiful and unique partnership. There's a lot of partnerships in farming and in healthcare and in music. But can you imagine life without any of them? Can you imagine this many babies without good maternity care? Can you imagine putting that many babies to bed without a lullaby? Or that many babies at all? We might not all be farmers, and we might not all be musicians, but we are all in this healthcare coop together, looking outside of ourselves for connections with others. Building partnerships is how we are going to make it work. That is my hope for healthcare. So I offer a bouquet to all healthcare providers, all farmers, and all musicians everywhere. You're doing a marvelous job. Keep doing what you're doing. Keep listening to each other. And thank you very much for this opportunity.